everyone, it's another Keyworker interview. This time I'm interviewing Ruth. I thought I'd let Ruth introduce herself.
Hi everybody, I'm Ruth. I've been coming to St Leonard's for about 10 years now, and we first moved here to Ensham in 2010, which was for my job.
Cool, and so what is your job?
I'm an anaesthetic consultant, which generally means to most people that I put people to sleep. That boring. But I do quite a lot of other stuff. So in my anaesthetic part of my job, I specifically tend to look after people in the emergency theatres, trauma theatres. I do some anaesthetics for people having spinal surgery, and I look after people with acute pain who are inpatients in the hospital. And then I have a big training and education role, and I do a lot of teaching in our simulation centre, mostly with foundation doctors, but also with other doctors as well. And the foundation doctors are very new doctors, they're first and second year trainees. And then my other big training roles really are that I'm a college tutor for the Royal College of Anaesthetists, which sounds really big and posh, but basically that means that in every hospital there are people who are nominated as tutors to look after the training requirements of the anaesthetic trainees. And they go through this very long 7-year training programme, and they sort of have to move around various specialties and make sure they cover various parts of training. So I help coordinate that within our hospital, make sure the trainees are happy, get sign off that their hours of work are okay, and deal with any other sorts of very often pastoral problems that come up for them.
Cool. So what part of your job do you love the most?
That's a really good question. Actually, I love all of my job. I do actually really love all of my job. I feel really lucky that I get to meet members of the public and look after them at times when they're really, really very scared and feel very vulnerable, and help them feel better. And a lot of it's not about what you do. A lot of it's just about being there for them and talking to them and reassuring them that everything will be all right. So hopefully a useful skill for this next period of time. And then very similarly with the trainees, I mean, I work with some really awesome trainees who just, they do all sorts of amazing projects. You know, some of them disappear with mercy ships overseas and go and work in the medical mission field. Some of them are doing their training whilst bringing up lots of, small tribes of children. Some of them go on, mountain expeditions. Some of them are training in more than one specialty. So they're training in anaesthetics and intensive care. It's just, the whole thing is just a pleasure to work with them all.
What's it like at the moment in your job with the current situation?
At the moment, things have become very much more about preparing people for what's coming over the last few weeks. And my role has actually been a lot more about training and teaching, but we put together a whole pile of protocols about how you undertake various tasks in relation to looking after a patient who's COVID positive. Because one of the really big problems for us as anaesthetists is the biggest risk of spreading COVID is in what have been termed aerosol generating procedures. And this unfortunately pretty much involves everything an anaesthetist does. So we're having to do a lot of work, not just with the anaesthetist, but with all the theatre personnel, so that everybody knows how the theatres need to work, what levels of protective equipment they need to wear, because they're different depending on what you're doing, how to put that on, most importantly, how to take it off safely, how to make the theatres work so that they work in a manner that means we can get the patients through safely, keep the staff safe, and also keep the patients safe. So that's one big bit. What else have I done? Oh, lots of work on the rotas for everybody, really, to do with really the trainee rotas and where we might have to move to. And there's a lot of talk at the minute about what are called surge rotas, and surge is when the wave of patients with COVID hits the hospital and require intensive care input. And there's a lot of plans in place within all organisations about how you go from your normal level of beds to look after patients who need to be ventilated through to significantly more patients. And those plans are really, really well in place. And, just to reassure people that has a lot of thought has gone into how we will look after lots of patients.
What about for us locally as patients? How are things going in the hospital? Are you feeling okay?
So I think the hospital's really well set up. I think that stems a lot from there's a very large infectious diseases set up within the hospital, and the consultants from there are really good and a phenomenal amount of expertise, as do the nursing staff and all the other people. and they've been trained for a long time in how to deal with Ebola level infections, and this isn't as dangerous as Ebola in many respects. It just will affect more people, and also because for years and years we've all been expecting a flu pandemic that will cause chaos. There have been lots of plans in place, and basically there's a way of rolling stuff out across the hospital to increase the number of beds that are available and to make sure there's enough equipment for people, and that includes ventilators. And it transpires one of the things that's normally a really big problem for us, which is the split site nature of the Oxford University hospitals, is actually a really good thing in some respects, in that we have extra oxygen supplies that hospitals in London don't have, and they've been worrying about running out of oxygen. So some of the things that normally cause us an organisational headache have actually worked out in our favour, I think.
So what about you? How are you doing? Is there anything we can do as a church family to support you?
I think I'm really lucky in that I've got a great family to support me. For anyone who doesn't know, I'm married to James, the big tall gentleman who used to be the church warden. We have 2 great children, Adam and Jonathan, and they're amazing, and they're just normality when I get home. The other thing that feels really normal is home group. Home group is just amazing. We're not meeting in person, obviously, we're meeting on Zoom, but just having that normality of meeting up and sharing prayer requests on a Thursday night has been awesome. The other thing that has been really great is, normally when I have to be at work on a Sunday, I miss church, but actually now in the current environment, I'm not missing church because it's all online. It's amazing. Otherwise, I think I'm probably almost in a better position than many of you, because I get to go out to work every day and I get to see other people and I get to interact with people. So I count myself as very lucky, and my journey to work and parking is so much easier because there's no traffic. Yeah, and just to say, on the other side of things, just at the moment, James is just being an amazingly awesome cook. Anyone who knows him, he is a really good cook, so it's great.
As a church family, the 2 churches, how should we be praying? What should we be praying for? So
I think I was trying to think about this, and for me, the things that I'd really like prayed for are for my patients, or the patients that come into the hospital. A lot of them are very scared, and they're scared because they're coming either in with symptoms of COVID and are really not very well, or they're scared because they have something else and they don't want to go to hospital because they've got COVID. So just for example, this week, I've had some really sick patients, really unwell patients, just with appendicitis, who probably should have come to hospital sooner, and their operations are delayed and they're more unwell because they didn't come because they're worried about getting COVID. Yeah. And then there are other patients who have slightly less emergency operations but need urgent operations, and I think we should pray for them as well. And with this, I mean cancer type patients. And there are lots of plans going on about how to try and get them into hospital, but you've got to try and get them into hospital whilst keeping them safe and not exposing them to COVID, and also making sure there's adequate provision of anaesthetists and surgeons and intensive care unit beds and all other beds to look after them. That's a really big thing for patients. And then for the patients, actually, when they're in the hospital, I think it's probably quite scary. Relatives can't visit in the same way that they normally would be able to, and that's probably particularly bad for the vulnerable elderly patients that often come in. And also staff are having to, meet and greet everybody in a face mask at very least. And if they're coming down to the theatres, we're wearing different types of masks and full face visors, and it can be really difficult to understand what people are saying to you when they're wearing all this protective equipment. So yeah, I think probably for those patients. And then for the staff that I work with, I think really for well-being, and this is physically, that they remain well and they don't also get COVID and have problems with that, because I'm sure you're all aware that in the news there's lots of talk about healthcare workers becoming unwell and dying, and that's obviously makes people very frightened because they're just doing their job, but we're trying to keep them all as safe as possible, but it can be difficult. But also for people like me who don't normally work shifts in the hospital, in terms of I tend to work an on-call rota, and so I get called back in overnight if there's a problem, it's very likely that I will be working day and night shifts, and so I haven't done that for a very long time, and that could be very tiring and challenging. And then there's a whole psychological, emotional well-being side of things, just being scared of what might happen, being scared of what might happen to your family. So there are people who are worried that they'll take COVID home to their families and make them unwell. And then there are also those people emotionally who have sent their families away to keep them safe, but then they're going home to an empty house. So there's a lot of stuff there. So if you could really say well-being for staff, psychologically, emotionally and physically. And then I guess finally, just to make sure that all the preparations that have been put in place work, keep people safe, keep people well, and keep them well provisioned. Started to sort of set up resources within our department if anyone gets stuck in overnight and needs food, so there's food available. We've sourced shampoo, conditioner, all those sorts of practical things. And we've also started to source sleeping mats so that if people end up needing to sleep in our department overnight, they can. So yeah, the prayer for just all those things to be correct and in place.
Fantastic. Yeah, we'll definitely be praying. Thank you, Ruth. That's brilliant.
That's okay.
See you soon. Bye.